Most doctors won't admit that medication, injections, and even surgery will not provide long-term relief for your wrist, hand, and elbow pain. For many of those we work with, wrist pain often comes back, even after trying medications, injections, and worst case, getting surgery. If you're watching this and have already been to the doctor for your wrist and hand problems, chances are you've been prescribed some medication to reduce the pain. This was likely prescribed along with rest or avoidance of your specific activity. Now here's the problem. These recommendations don't work. Medications, injections, and other interventions like surgery do not provide long-term relief. And in this video, I'm going to help you understand why. For those of you who might not know, Elliot and I have specialized in working with gamers, desk workers, and individuals who deal with repetitive strain injuries of the elbow, wrist, and hand for the past 8 years. We've spoken at medical conferences, written textbooks, published research, and have dedicated the past decade to try to address this huge gap in the healthcare system. We've helped many individuals who have come to us because medications and injections and surgery didn't work. It might have provided them temporary relief, but they still had their pain return. And now I'm not saying that these never work, but in the case of a majority of repetitive strain injuries, they fail to address the underlying problem. So let's talk about the concept of source versus cause. If someone has developed pain from repetitive strain at the wrist and hand, here are some of the most common sources of pain. 1, the tendon, 2, the nerve, 3, the muscle, and 4, joint. Treating the source of the pain means doing things that directly reduce tissue stress on the involved tissue. And this can involve pharmacological approaches like medication to target different parts of these tissues. For example, ibuprofen helps with the pain by reducing the production of chemicals which can signal pain, your prostaglandins. And if a tendon, nerve, or muscle or joint is involved, reducing the signaling around pain doesn't address the cause in any way. The medication is just used for pain. And I think many of us understand this, but tissues can be injured in many ways. Tendons are overloaded when the demand of the activity exceeds the capacity of what it can handle. And this is often what happens at the wrist and hand. For example, if you are an artist and you have a deadline to finish a project, so you end up drawing for 10 to 12 hours for several days in a row, your tendons are likely going to be irritated. Or if you haven't played basketball for a while and you go to play several games, your heels or your knee might be irritated from the jumping and running. For nerves, they're typically irritated from compression at a certain site along where they travel from the neck, shoulder, all the way down to the fingers. And whether it be local irritation from swelling of other tissues like tendons, or postural related irritation where a certain muscle might be causing some pressure on the nerve. And this could be falling asleep with your arms overhead leading to nerve entrapment, or cubital tunnel syndrome. If the muscles at the forearm are tight or stiff, it can entrap the ulnar nerve as it travels between the fibers of the muscle. There's also trauma related cases, and they're different because there's clear external damage that's applied to the nerve or tissues. Muscles are also irritated from overuse, similar to how tendons are irritated. We repeatedly utilize a certain muscle past what it can tolerate in terms of strength and endurance, then the fibers might be strained, develop micro tears, and in more aggressive cases, partial or full tears. But again, all very likely in the case of a repetitive strain that has low load, low velocity type movements. Joints are often irritated when the supporting tissues, your muscles and tendons, are not able to support the joint, leading to more stress within the joint. And this can occur at the knuckles, but a good example is if you have weakness of the muscles around the knee, it can sometimes lead to swelling within the joint if you participate in a lot of activity that requires jumping, especially so after an extended period of time with lower levels of physical activity. So the cause of the problem in each of these situations are the activity or the movement, or even the cumulative activities, repetitive strain, that lead to the tissue being irritated. The source of the pain is the actual tissue themselves. And of course, this is more nuanced, but we can dig into it another time. And you can think of this like an overheating car engine. You bring your car into a mechanic, a doctor, who uses a tool, their objective assessments, to identify the source of the problem. In an example, it might be the radiator. So to fix a problem, they let you know you have to replace the radiator. This is the mechanic treating the source of the problem. A good mechanic, or doctor in this case, will ask in more detail about things like your recent oil changes, your driving habits, things that contribute to the engine overheating and the radiator being impacted. This is the mechanic treating or exploring what the cause of the problem might be. And it's always important to identify the cause so you can ensure you get long-term relief or resolution. So doctors should always evaluate in depth what lifestyle, your physical conditioning, your previous loading history, and other factors that could have led to your tissue strain. And if they haven't taken the time to do so, then they've failed to identify or treat the cause of the problem. But let's get into the actual science into why medications and rest-based interventions don't work. Most doctors provide the medications to help alleviate pain and make recommendations that reduce physical stress of those tissues like resting or bracing. But what is the actual source of the pain? Here's the distribution of what we've seen in the past 5 years with an N equals 1,441, 1,200 of those cases being tendon, around 114 being nerve. The majority of the injuries that we have seen resulting from repetitive strain are associated with the tendon. Nerves are involved in around 7.92% of the cases, followed by the muscle in around 3%. And many, if not all of the problems within the nerves also had the underlying tendon problem that led to local irritation of the nerves, cubital tunnel, for example, in the first place. So let's look at what happens with tendons when we use medication, injections, and surgery. And we'll also consider what happens in the short term and the long term. So for medication and rest, many physicians advise patients to avoid activity and take their medication. And as mentioned, the medication is for pain. The current research is still inconclusive in how non-steroidal anti-inflammatory medication or NSAIDs impact the healing and structure of tendons. There's research that seems to support the idea that with early administering of NSAIDs, it can actually delay the healing process, but with delayed administration of NSAIDs, it can help with healing. This is again still up in the air based on the current literature, but the main issue is what happens with rest. When we unload a tendon or rest, it can lead to changes at the cellular level and the supporting matrix that reduces the integrity of the tendon. The tendon just gets weaker. The connection between the brain and the muscle gets impaired, the muscle tendon complex weakens, and the entire control of your extremity, your arm or leg, is also negatively affected. In the short term, sure, the pain will go down. That's the source of the pain being addressed. But what about the actual ability of your tendons and essentially your hands to handle stress? Your function, what you want to do. That will get worse with rest. You won't lose too much in the short term, but with repeated cycles of medication and rest that always occur, when the patient goes back to see the doctor, the tissue can become really weak to a point where you can barely type, press keys, use your hands without any irritation. A lot of the complaints that we have our patients tell us. And in this situation, one of the common interventions that's typically recommended after this conservative approach of rest and medication doesn't work is the use of injections. So let's dive into what happens with injections, and specifically corticosteroid injections. Based on all of the current literature up to this point, corticosteroid injections are now considered harmful as an intervention for tendon pathology. We'll have the research listed in the actual description, but there have been countless studies that have shown that local corticosteroid injections for tendinopathies are not effective after the first few weeks. And so that means you'll get temporary relief of pain, but there's an increase in risk of re-injury and tendon rupture because the corticosteroid injections can lead to the tendon degenerating further. It can inhibit tendon repair and delay healing. And so when physicians recommend an injection for a tendon problem, this is what you have to weigh out. You're gonna get 3 to 4 weeks of pain relief. Great. But you're gonna have an increased risk of re-injury, tendon rupture, and likely increased chronicity of the issue if you're not doing any exercises to address the capacity problem. This should really be an easy decision for any patient when presented with this information. And unfortunately, this is not the information that's presented from the physician. The only thing the injection is helpful for is temporary pain relief in the short term. And long term, it will likely delay your recovery process as a result of the detrimental effects on your tendon physiology. So what if after the corticosteroid injection still didn't work, which we expect? Then sometimes surgery will be recommended. Obviously, there's different types of surgeries that can be performed, all with different goals depending on the surgery, whether it be removal of tissue, cleaning up the tissue within a joint, anatomical location, or fixation of tissues in certain areas. You as a patient still have to realize the most important thing. Does removing a tissue or reconstructing a tendon change the fact that maybe your lifestyle, your schedule, your wrist conditioning led to the tissue getting to that state in the first place? And if we do remove tissue and fail to address those underlying issues, sometimes the rehabilitation will be a forcing function to improve those, which is why sometimes there is success. But in most cases, we're not really solving the problem with surgery, which is why performing exercises and addressing the underlying deficits within your lifestyle, posture, and modifying your activity is important. And guess what? Even if pathological tissue is found in tendons, the research has shown we do not need to aim our treatments at trying to change the structure or pathology of the tendon. Normalizing the tendon structure is not needed, since there's often more healthy tissue in a pathological tendon that we can target with loading and exercise. Quite literally, all of the evidence and research available on top of our experience treating patients over the past decade has shown us that to actually recover from any RSI, you have to perform exercises to build up the tissue's endurance and capacity. And on top of that, you might have to make the right modifications to your activity, not completely avoid it, to reduce the external stress while you're building up your tissue's ability to handle more stress over time. And that's it. It sounds simple, but it isn't always that way in practice. Unfortunately, our healthcare system doesn't always equip us with the right knowledge immediately or get us to the right provider, and it leads us to these cycles of rest and pain. And I'm hoping that after seeing this or watching this right now, you have a better understanding of why medications, injections, and surgery do not work for RSI of the wrist and hand, and you actually do have more control than you realize in what you can do about it. And if you want to learn more about the science of RSI, learn more about exercises you can perform specific to your problem, check out this video right here.